This program is divided into a number of modules. We'll describe the DSM criteria for depression. We'll discuss the essential elements of the treatment planning process, provide a brief history of the empirically supported treatment or EST movement, and discuss how to empirically inform a treatment plan with findings from the EST literature on depression. Finally, we'll spend some time discussing common considerations in relapse prevention.
The first step in treatment planning is to identify your client's manifestations of depression. When you put this all together, you get a behavioral definition of the problem. For example, your client may exhibit sad mood, express loss of interest in previously interesting activities, may be withdrawing from activities, feeling tired all the time, and having trouble sleeping. Other clients may show other manifestations of depression. Accordingly, the behavioral definition of your treatment plan is tailored to your individual client's clinical picture.
Now, the next step is to set some long-term goals. For example, a common goal of all treatments for depression is to reduce the distress produced by the symptoms and re-engage in a functional life. Perhaps your client shows depressive thinking patterns or beliefs that you believe maintain the depression and make him or her vulnerable for relapse. In this case, a long-term goal such as this would be appropriate. Again, long-term goals are tailored to your client's manifestation of depression and reflect the eventual desired outcome of therapy.
Okay, Maria, have you gotten out to be much with your friends or to do some of your volunteer work at Big Sisters or just do things like walking around the mall like you used to?
No, I haven't felt like doing anything. I just don't seem to have that energy.
Now, Maria, as you know, as we've been discussing, one of the things that you can do to be able to lift depression is to increase your level of activity. Being more active can help you to increase your just general sense of pleasure, help you to feel more useful, and build your confidence. I know it's difficult to get moving again, but I'd like you to try to start with some very small activities and build up to some more ambitious projects. Do you think you can try that?
I'm not sure.
I know some of the things that you've enjoyed doing in the past, but I'd like you to look at this list. It's over 100 different pleasurable things that you can do to help get yourself moving again. I want you to look it over and take it home, complete a homework assignment with it.
This was a good introduction to behavioral activation, I thought, Tim.
Yeah, I think it's, I thought it's a clear-cut kind of demonstration of what this technique involves. I think that the therapist did a good job of explaining the rationale, I think, which makes it very understandable to the client. Why are we doing this? And I think, I think you have to engage him. So he was asking her, do you think you can do this? Because with the depression and the lethargy and the fatigue and all this is asking a lot of clients.